This week we're looking at a less common and often overlooked source of knee pain, our proximal tib-fib joint. But first, our disclaimer. Mike Matthews, physical therapist, here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I said, this week we're looking at the proximal tib-fib joint, a pretty uncommon source of knee pain, but it is definitely overlooked. I've seen a few people over the last decade that we're just stumped. We're trying to figure out what's going on with their knee pain. They're having knee pain on the lateral side, on the outside of this joint right here. We just can't figure out what the problem is. We try to look at our strength, we look at our IT band, we look at our mobility, everything that has to do with the knee. We look at everything we can do with the individual joints of the knee and all the individual muscles and ligaments and the meniscus and everything, and we're just stumped. We can't figure out that lateral knee pain. Well, we actually have to look at that proximal tibulofibular joint right here. We have our tibia, our larger shin bone right here, and our smaller fibula right here, and they actually form two different joints. They'll form a joint up here, up at the knee, where they actually join together, and then they separate, go their separate ways, and then they come back down here at the ankle, and they actually come together again at our distal tibiofibular joint. Now, sometimes these joints can get locked up, they can get immobile, and oftentimes this can happen after either a knee or an ankle injury, especially after that injury. If it ends up getting immobilized with some sort of immobilizer, a brace, a boot, or a cast, or anything in between. Anytime something gets immobilized, all the tissues around it tend to get tighter, the joints around it tend to lock up and get less mobile. So if you have a medical history like this and you have a mysterious lateral knee pain that no matter what you throw at it, it's not getting better, it'd probably be a good idea to go ahead and mobilize this joint to see if we can get it moving, see if we can get some relief from there, because we might surprise ourselves and it might actually help. So we're gonna have a seat for these two mobilizations, and we're gonna flip around so that our foot is up here on the surface with us. We're gonna have our knee at about a 90-degree angle here. This is gonna put that PTFJ joint in an open pack position, the least amount of stretch and pull of the tissue surrounding this, so we can actually get some movement coming from here. So at about a 90-degree angle here, you're gonna take the heel of your hand, your thenar eminence over here on your thumb side, you're gonna put it right behind that fibular head right here, that little bone that you see that sticks out right there. You're going to put it right behind here, and you're going to take your fingers here and you're going to grasp around on the other side here. And it's not a big movement. I'll try to see if I can give you a little bit better angle to start off with. So it's a really small grip right here. You're going to grab onto that fibular head and down on that fibula a little bit there. We'll do it sitting here, knee bent at 90 degrees. You have your other hand here on your knee just to stabilize. You're just going to go straight forward and straight back, perpendicular to your shin right here. You're just going to mobilize back and forth, oscillate it there. Going to do it for about 2 to 3 minutes at a time. You want to work this several times a day. I know every 2 hours can be difficult for most people. So if you can't do it every 2 hours, do it every 3 or every 4 hours, just as often as you can. Get it nice and mobilized. When we're working on this mobilization and the next one for that matter, you want to give it about a week before you decide if it is or if it isn't helping. So working on that there while stabilizing up here, 2 to 3 minutes at a time, several times a day. Now the next one we're going to do is grab onto the foot here. Oh, and we got to keep our knee at about that 90-degree angle. I had it a little too tight right there. We're grabbing on there. We're just forcing our foot back into dorsiflexion here. What's going to happen here is we have a talus right here, a talar bone right here in our ankle, and there's a dome up here at the top that whenever we force our foot up this way, that dome goes between our tibia and our fibula right here and creates a little bit of space and can mobilize that joint down there, and it'll actually mobilize it up here as well. So you're going to grab down there, same thing, just oscillating it, pressure on, pressure off here. Going to work this about 2 to 3 minutes at a time, several times a day. And like I said, don't come to a conclusion too early. Give this a few weeks to work. So if you've had issues with that lateral knee for a while, pain in that area, and nothing that you've tried has worked, it's definitely worth a try. I can't guarantee that it'll work, but there is a small chance that it will, that this is your issue. So make sure that you work on that there. Now I have another video that I have planned out for the ankle series. We're going to talk about what to expect after a specific type of ankle surgery. So make sure you stay tuned for that one. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.